Are you over 60? Do you sometimes experience aches and pains and just brush them off as a normal part of getting older? We all do it. A little stiffness here, a twinge there. It seems like part of the package deal of aging. But what if I told you that one specific type of common pain, often dismissed, could actually be a silent warning signal? A signal so critical that ignoring it might genuinely be a very serious, even life-threatening mistake. Stay right here, because in the next few minutes, we're going to uncover why that seemingly ordinary pain you might be tempted to ignore absolutely needs your attention. We're not here to scare you unnecessarily, but to empower you with knowledge. Knowledge that could potentially safeguard your health and well-being in your golden years. Many people think, oh, it's just old age, but sometimes your body is trying to tell you something much more urgent. We'll explore what kind of pain we're talking about, why it's so easy to overlook, and crucially, what serious issues it might be pointing towards. This isn't just another health talk. This is about understanding the subtle language of your body and knowing when a simple ache is more than just an ache. Don't click away. Understanding this could make all the difference. Let's learn together how to listen carefully to our bodies and take proactive steps for a healthier, happier future. We will break down complex information into very simple, easy to understand pieces, ensuring everyone can grasp these vital points. So what kind of pain are we focusing on today? It's not just any fleeting discomfort. We're talking about persistent pain, particularly pain that seems to come out of nowhere or is different from your usual aches. Think about a nagging discomfort in your chest, maybe pressure or squeezing, that you might dismiss as indigestion or muscle strain. Or consider persistent pain or swelling in one leg, perhaps accompanied by warmth or redness, which you might think is just a pulled muscle or arthritis. Another example could be a sudden severe headache, unlike any you've had before, maybe with dizziness or vision changes, which is easy to attribute to stress or needing new glasses. Let's imagine a fictional person. Let's call him Arthur. Arthur, a generally healthy man in his late 60s, started feeling an unusual ache in his calf. It wasn't severe, just a persistent dull ache and a bit of swelling. He thought, I must have overdone it gardening, and decided to rest it. He ignored it for weeks, thinking it would surely go away on its own. This is incredibly common. We find logical explanations. We normalize the discomfort because admitting something might be seriously wrong can be frightening. This specific type of persistent, unexplained pain, whether in the chest, leg, head, or even abdomen, is what needs closer examination. It's the pain that lingers, the pain that changes, or the pain that comes with other subtle symptoms. It's crucial to understand that while many aches are indeed benign, some carry urgent messages from your body. Why is it so incredibly easy to dismiss these potentially serious pains, especially after 60? There are several very human reasons. Firstly, there's the pervasive belief that aches and pains are simply an unavoidable consequence of aging. We hear it all the time and perhaps even say it ourselves. Well, what do you expect at my age? This normalization makes it easy to downplay symptoms that, in a younger person, might raise immediate alarms. Secondly, there's often a fear factor. Fear of doctors, fear of hospitals, fear of finding out something is seriously wrong. Sometimes ignorance feels like bliss, and we subconsciously choose to believe it's nothing rather than confront a potentially scary diagnosis. Thirdly, life is busy. Even in retirement, there are things to do, people to see. We might think we don't have time to be sick or to make a doctor's appointment for just an ache. We might also have had similar, less serious pains before, leading to a false sense of security. Oh, it's probably just like that time last year. Furthermore, some individuals have a high pain tolerance or simply don't want to seem like they are complaining. They might feel they should be stoic or not burden their families or doctors. All these factors, normalization of aging pains, fear, busyness, past experiences, and a desire not to complain, create a perfect storm where potentially critical warnings signs get ignored until it's possibly too late. Recognizing these tendencies in ourselves is the first step towards overcoming them. This is the crucial part. What serious conditions could be hiding behind that seemingly common pain? Let's be clear, we are not diagnosing anyone here, but explaining possibilities that doctors consider. Persistent chest discomfort, pressure, or pain radiating to the arm, neck, or jaw should never be ignored, as it could potentially signal heart problems, like angina or even a heart attack. Ignoring this could delay life-saving treatment. That persistent pain, swelling, warmth, or redness in one leg, like Arthur experienced, it could potentially be a sign of a deep vein thrombosis, DVT, a blood clot in the leg. If ignored, a piece of that clot could break off and travel to the lungs, causing a pulmonary embolism, which is a medical emergency. A sudden severe headache, often described as the worst headache of your life, especially if accompanied by dizziness, confusion, numbness, or vision problems, could potentially indicate a serious neurological event like a stroke or an aneurysm. Again, immediate medical attention is vital. Persistent abdominal pain, especially if it's severe, localized, or comes with changes in bowel habits, fever, or unexplained weight loss, could point towards various underlying issues within the digestive system or other organs that require investigation. The key takeaway is that while these pains can sometimes be benign, they can also be the first and only warning sign of a condition where early diagnosis and treatment dramatically improve outcomes. Ignoring them essentially means gambling with your health. Okay, so we know ignoring certain pains is risky, but when should you definitely stop guessing and seek medical help? Think of these as red flags, warning signs that require prompt attention. Firstly, consider the onset and severity. Any pain that comes on suddenly and is severe, especially if you'd rate it high on a 1 to 10 scale, needs checking out. Don't try to tough it out. Secondly, pay attention to accompanying symptoms. Pain that comes with other signs like shortness of breath, dizziness, fainting, sudden weakness or numbness, especially on one side of the body, confusion, difficulty speaking, vision changes, high fever, chills, or unexplained sweating is a major red flag. These combinations often point towards more serious underlying issues. Thirdly, look at the pattern and duration. Pain that doesn't improve with simple home care, like rest or over-the-counter pain relievers, pain that progressively worsens over time, or pain that wakes you up at night should be evaluated. Fourthly, consider the location and type. While we discuss chest, leg, and head pain, any persistent, unexplained severe pain anywhere in the body warrants attention. Also, pain described as crushing, tearing, ripping, or pressure often carries more significance than a dull ache. If you experience any of these red flags, don't wait. Call your doctor, or depending on the severity and accompanying symptoms, seek emergency medical care immediately. It's always better to be safe than sorry. Beyond recognizing specific red flags, there's a fundamental principle. Learn to listen to your body. As we age, it's true that our bodies change. We might have more background noise, the everyday aches of arthritis or old injuries. However, you are the expert on your own body. You know what feels normal for you, even if that normal includes some chronic discomfort. The key is to pay attention to changes from that baseline. Is this a new type of pain? Is it in a different location? Is it significantly more intense than usual? Does it feel different? Sharp instead of dull? Constant instead of intermittent? Your intuition matters. If something feels off or genuinely wrong, even if you can't quite put your finger on why, trust that feeling. Don't let the "it's just old age" narrative completely silence your body's signals. While aging brings changes, debilitating or alarming new pain is not a standard feature. Think of your body as constantly communicating with you. Most of the time, it's just background chatter, but sometimes it sends an urgent message. Ignoring those urgent messages is like ignoring a smoke alarm because you assume it's just burnt toast. Taking your symptoms seriously and seeking clarification from a healthcare professional is not a sign of weakness. It's a sign of wisdom and self-care. It's about partnering with your body to ensure your health long-term. So you've decided a pain needs checking out. How do you talk to your doctor effectively to get the help you need? Being prepared can make a big difference. Before your appointment, think about the specifics of your pain. Firstly, location. Where exactly does it hurt? Can you point to a specific spot? or is it more generalized? Does the pain stay in one place, or does it travel, radiate anywhere else? Secondly, quality. What does the pain feel like? Try to use descriptive words. Is it sharp, dull, aching, burning, stabbing, throbbing, cramping, pressure, tightness? Thirdly, intensity. How bad is the pain? Using a scale from 0, no pain, to 10, worst imaginable pain, can be very helpful for your doctor. Note if the intensity changes. Fourthly, timing and duration. When did the pain start? Is it constant or does it come and go? Intermittent. If it comes and goes, how long does each episode last and how often does it happen? What time of day is it worse or better? Fifthly, what makes it better or worse? Does anything seem to trigger the pain, like activity, eating, certain positions? Does anything relieve it, like rest, specific positions, medication? Lastly, mention any associated symptoms, even if they seem unrelated, like the dizziness, shortness of breath, fever, or other red flags we discussed. Write these points down before you go. Being clear and specific helps your doctor understand the problem better and decide on the necessary investigations or treatments. Don't downplay your symptoms out of fear or embarrassment. Your health is the priority. We've covered a lot today, but the core message is simple and vital. While many aches and pains after 60 are indeed just part of life, certain types of persistent, severe, or unusual pain should never be ignored. Dismissing them as just old age can unfortunately lead to delayed diagnosis of potentially serious conditions where early intervention is key. We talked about common culprits like persistent chest, leg, or head pain, the reasons we tend to ignore them, and the critical red flags like sudden onset, severity, and accompanying symptoms that demand immediate attention. Remember Arthur, who ignored his leg pain? Seeking help earlier could have potentially prevented complications. Listening to your body, trusting your intuition when something feels wrong, and communicating effectively with your doctor are powerful tools for protecting your health. Your well-being is precious, and you deserve to have your concerns taken seriously. Don't gamble with warning signs. If you found this information helpful, please give this video a thumbs up. It helps others find it too. Consider subscribing to our channel for more practical health insights for your best years. And please share this video with friends, family, or anyone over 60 who might benefit from this crucial reminder. Most importantly, we want to hear from you. Have you ever experienced a pain you initially ignored but later found out was serious? Share your experiences, without personal medical details, of course, in the comments below. Let's create a supportive community looking out for each other. Thank you for watching, stay vigilant, and prioritize your health.